Colon cancer is a type of cancer that affects the colon. Colon is the last part of the large intestine of the digestive system. Colon cancer is a cancer that occurs in the last 15 centimeters of the colon that meets part of the rectum region, and these two types of cancer together claim colorectal cancer or rectal colon cancer. In most cases, colon cancer begins as a small mass of non-cancerous cells called adenomatous polyp. After a period of time, the cells formed become cancerous masses present in the colon. These can be small and accompanied by very few, if any, symptoms, and regular imaging scans can prevent the emergence and development of colon cancer by early detection before they turn into cancerous tumors. Most people who develop colon cancer do not have any symptoms in the early stages of the disease, and when colon cancer symptoms begin to appear, they vary from case to case and are linked to the size of the cancerous tumor and its location within the colon. Changes in normal intestinal activity, manifested in diarrhea, constipation, or changes in the fecal view and the frequency of excretion, last for more than 2 weeks. Bleed from the anus or the appearance of blood in the poo. Tight in the abdominal area, manifested in colic, invasive bulges and aches. A feeling that the pooping has not completely emptied the intestines. Fatigue or weakness. Unexplained drop in weight. Having blood in the stool can indicate a cancerous tumor, but it can also indicate a variety of other health problems. If the color of the blood is pale red that can be seen on toilet paper, it is more likely to come from hemorrhoids or possibly a nail incision. Despite all this, it is strongly recommended that any sign of fecal hemorrhage be thoroughly examined by the attending physician, because the presence of blood in the stool can sometimes indicate a more serious disease. Colon cancer generally consists when a change occurs in a group of healthy cells. Healthy cells grow and divide regularly and in a coordinated manner in order to give the body the possibility to function and perform its functions normally and properly. But the process of cell growth and division is sometimes out of control, and cells may continue to divide and multiply even without the need for such a large number of cells. This excessive increase in the number of cells in the colorectal region can be accompanied by precancerous cell production, precancerous, within the inner colon envelope, and over a very long period of time, up to several years, some of these precancerous cells can become cancerous cells. In advanced stages of colon cancer can penetrate the colon wall and spread to nearby lymphoma or to other internal organs. As in all cancers, the exact real cause of colon cancer formation is still unknown. Precancerous tumors can arise anywhere along the colon, where the colon consists of 120-150 cm at the top and is called the intestine, while the rectum forms the last 15 cm of it. Precancerous tumors often appear as a mass of cells that emerge from the colon wall, and these precancerous tumors can also appear as a level and flat spot, or as a cavity in the colon wall, and this type is complex in terms of detection, since it is very rare. Several types of liquid are found in the colon, including adenoma, hyperplastic polyps, and inflammatory polyps. About 90% of people diagnosed with colon cancer are over 50 years old. If it refers to the emergence of weapons in the colon, or in the rectum. Genetic syndromes that are transmitted in the family from age to age can increase the risk of colon cancer. These syndromes are responsible for 5% of all colon cancer cases. Family adenomatous polyposis, FAP, a rare syndrome that causes thousands of tuberculosis on the walls of the intestine and in the rectum, untreated, increases the risk of colon cancer until the age of 45 by more than 90%. Lynch syndrome, or NOBTHA, which is more prevalent than family LGBs, is more susceptible to colon cancer at an early age. If in the family there are previous colon or bowel cancer infections or colonoscopies, periodic detection is required. Colorectal cancer may be associated with low fiber or high fat and calorie diets. Failure or lack of physical activity may increase the risk of injury. Drinking alcohol in excessive quantities can increase the risk of developing colon cancer. Other factors include the following: diabetes, excessive obesity, smoking, disorders in growth hormone, radiation treatments for cancer. Routine scans for colon cancer are preferred and recommended from the age of 50 for all people who can be on the list of people at risk of colon cancer. There are several scans, each with pros and cons. It is important to talk to the attending physician about the options available to everyone to make a joint decision on which of these tests is most appropriate. Occult blood test. This test examines a sample of stool with the aim of diagnosing the injury. Deoxygenated RNA testing, deoxyribonucleic acid DNA. This examination is carried out through a stool sample where the analysis of several nucleic acids originating in cells secreted by precancerous liquid into the stool. Sigmoidoscopy. It is an examination of the interior of the colon. In this test, the doctor uses a flexible light tube to inspect the colon from the inside for up to 60 centimeters in the interior of the colon. Barium enema. This test allows the doctor to examine the colon with the help of X-rays and barium inserted into the colon by an enema. Colonoscopy. This examination is very similar to the scan, but the tool used in colonoscopy is a long, narrow, and flexible hose attached to a video camera and screen that allows the attending physician to inspect the colorectal along them, thus detecting colon cancer. Virtual colonoscopy. It is an endoscopy done by a CT scanner. Although this scan is not available in all medical centers, but it is another important option for scanning and imaging. This scan uses a CT scanner to produce colon imaging plates instead of using equipment inserted into the intestine through the anus. Double contrast enema. This inspection is performed once every 5 years. After the diagnosis of colon cancer has been confirmed, the attending physician conducts several tests to assess the degree of disease or the extent of cancer outbreaks in the body, and the gradual progression of colon cancer helps to determine the most appropriate and useful quality and treatment method. Stage 0. The cancerous tumor is still in its initial stages, as colon cancer has not yet grown or spread beyond the inner lining of the colon or rectum, at which point the cancer can be described as a malignant tumor. Phase 1. The cancerous tumor has grown and spread to the outside of the colon lining, but it has not yet moved out of the colon or rectal wall. Phase 2. The cancerous tumor has grown, spread, and penetrated the colon or rectal wall, but it has not yet moved to the adjacent lymph nodes. Phase 3. The cancerous tumor has grown, spread, and reached the adjacent lymphoma nodes, but it does not affect other organs in the body yet. Phase 4. The cancerous tumor has grown and spread widely in the body, for example to other internal organs, such as the liver, lungs, the membrane encapsulating the abdominal cavity, or one of the ovaries in women. The tumor resurfaces again and again, which means that the cancer has reappeared after treatment. There is the possibility that the cancer may reappear in the colon's interior, in the rectum, or in any other organ of the body. Prevention of colon cancer. To prevent cancer, follow the following tips. Surgeries for cancer prevention in some very rare cases, such as the presence of genetic factors or inflammatory bowel syndromes, such as ulcerative colitis. In general, cancer oncologists are advised to completely ablate the colon and rectum and remove them altogether, so as to prevent future oncology. Lifestyle change to reduce risk of infection. There are many steps one can take to reduce the risk of colon cancer by making some lifestyle changes, including: eat plenty of fruits, vegetables, and whole grains. Reduce fat, especially saturated fat. A balanced and diverse diet in order to increase the amount of vitamins and minerals the body needs. Reduce alcohol consumption. Stop smoking. Exercise physical activity and maintain healthy weight. The type of treatment for colon cancer that an attending physician can recommend is largely related to the stage at which the cancer has reached. The 3 main types of treatment are surgical treatment, chemical processing, radiation treatment. Surgery for colectomy is the main solution for the treatment of colon cancer. for the size of the part to be removed from the colon during the surgery, or whether there are other additional therapeutic types such as radiotherapy or chemotherapy that constitute a suitable solution for the patient. It relates to several factors, the most important of which are the location of the cancerous tumor, the depth that the cancer penetrated into the colon wall, and whether the cancer passed to the lymphoma or other internal organs of the body. If the cancer has reached a very advanced stage, or if the general health condition is weak and deteriorating, the most appropriate solution may be surgery to open the obstruction of the colon, thereby alleviating the symptoms that cause distress and suffering. The procedure is performed in the following steps. The surgeon removes the part of the colon containing the cancerous tumor with additional edges of the surrounding healthy tissue from all sides in order to ensure that it's the lymphoma next to the large intestine is removed for inspection and examination to ensure that there are no cancer cells in it. The surgeon can usually reconnect the remaining intact part of the colon with the rectum. If this is not possible, a temporary or permanent vacuum may be required. A vacuum is opened in the colon wall, and a special bag is delivered to it. This gap may sometimes be temporary to help the intestine and rectum recover and heal after surgery, however. Other times there may be a need to keep the gap permanently open. But if the cancer tumor is small, centered at a very early stage of development, the surgeon can remove the whole tumor during a colonoscopy exam.